Hey, aloha gang, Dr.Russ, Rosen here. Welcome to the OHC community, Facebook community masterclass on the neuroscience of communications. So we are here 3 Tuesdays a month right here at 1:30 Pacific time. And we dive into very specific subjects. Right now, we're talking about the neuroscience of communications, and then we'll be diving into how to apply that to the consult, to the exam, to the reported findings, etc., etc., etc. My goal is to help natural healthcare providers like you thrive in a care versus scare true optimal health model. If you find value in today's program, please let others know about it. I'm going to go ahead and type right here. Let me know if you are here. And if you have any questions. So I'm going to go ahead and give my wrap, and then I'll be checking to see if there's any questions. Okay, so we got to move this over here. So here's what I know to be true. I know that you want to help your patients get healthy and stay healthy. I know that you recognize you can do way more for them than just help them feel better and relieve their symptoms. And I know that you really want them to get the value of what you do so they happily stay, pay, and refer for a lifetime. But I also know that many of us get really frustrated because we have such a gift to give, but people don't understand it. They don't value it. They don't want to pay for it. And in essence, they just don't get it. And that frustrates a lot of us. And if we want them to get it, we need to learn to speak in a different way. What we've been doing doesn't work. Speaking at people, lecturing people, educating people doesn't work. We need to understand the neuroscience of communication. Now, if you want to thrive in a true care versus care, true optimal health model, where you help people get healthy and stay healthy versus just getting out of pain, it's a completely different ball game, because they're going to need to stick around for a long time to be able to get the most that they can get from your care. It's not like trying to get rid of a sore neck real quick, right? So we're going to have to communicate in a different way. So what I don't want to do is I don't want to use scare tactics, subluxation, the silent killer, right? I don't want to use manipulation. I don't want to use fear. Instead, I want to empower them to make reasonable and logical decisions by giving love and choices and truth and consequences. We're going to love them. We're going to give them real choices. We'll always tell the truth and the consequences of their choices. And then we're going to find out what they want in relationship to what we can truly do for them, show them how to have it. It's a really, really simple concept. So in the optimal health model, we recognize, and we talked about this last week, we recognize our role that we play. Can you be everything to everyone? No, you can't. You just can't do it. Are you going to teach yoga? Are you going to teach meditation? Are you going to be their priest? Like, are you going to do all the nutrition for everyone? Maybe you don't like to do that and you want someone else to do it. So you're going to recognize your role as part of their healthcare team. Now, if we were to work with them and they were to do everything we recommended, could they possibly feel better? Sure. Could we possibly help them prevent problems in the future? Of course. Could we help them be healthier in 5 years than they are right now? Well, yeah, I mean, if they're really following our recommendations, if you're a chiropractor, you're correcting their subluxations and giving lifestyle advice, showing them ways to eat better, exercise, and deal with stress, should they be healthier in 5 years than they are right now? Or at least could they? Yes, of course. And could they have a better life? Okay, so if that's what you want to accomplish, again, we have to learn different ways to communicate that. Now, I've talked a lot about RFK Jr., and, there's no question more and more people, the MAHA movement, are aware of, in the United States, that it's not working, that we have the sickest nation. I think we're 36. I mean, people are becoming aware of this. They're looking for someone like you. The problem is you're the best kept secret in town. But imagine everyone started recognizing all you could do. How would you handle the load? Right? Big problem. A lot of the docs that I coach, that's their problem. I cannot handle this load. Okay, that's the problem I wish for you. One of the tools that we use is this right here. And if you jump into the club this Thursday, 11 o'clock California time live, we'll be having a discussion about all of this and going into great detail for an entire hour on this. And you can download this for free. But this is a path to optimal health. And we do a lot of things to plant seeds, and then we just ask our patients, -10 is near death, 0 is comfort. You feel good, but you're not functioning at your optimum. And then +10 is you as healthy as you can be. And we would know it because of these tests, not just how you feel, but how you're functioning and how our tests are. Of course, that depends on the kind of work you do and the tests that you do. So we literally find out what they want in relationship to what we can do for them. So where do you think you're at? Where do you want to get to? Right? That's her choice. How long do you think it would take? How motivated are you to get there? If you got there, what would we need to do? If we got there, what would you hope for? Obviously, symptoms to go away, but what else? Right? What caused you? What caused you to end up here? So this is a really wonderful tool. So we're going to find out what they want in relationship to what we can truly do for them, and then show them how to have it. You'll notice I didn't say find out what they want, show them how to have it. Want my neck cracked. I'm not going to do that. I'm going to find out what they want in relationship to what I can do for them. Can I do more than just crack their neck? Yes. I can help them resolve issues. I can help them get healthy, stay healthy. I can help them do all kinds of things. My job is to help them understand what I can do for them. Their job is to choose what they would like. Okay? So again, we'll be going into great detail, and you can download that if you'd like access to the club. I'll give you a free month, and just jump on in. Just put club below, and I'll give you a link to that. Okay, so one of the things that comes up when I'm talking to docs about this is they get people to start saying, I want to get healthy, I want to stay healthy, I want to do whatever it takes. And then they whisper to me, I'm not sure I can deliver that. Right? So that happens very often with the docs that I'm coaching. If that's a challenge for you, just comment below. Let me know that, and I can chat it down with you. I can help you look at things you may want to do about that. Okay, so last time we were getting really clear about what do I do? Well, I help people get healthy, stay healthy, and have the best life possible. How do you do it? Well, I correct nerve interference, subluxation, show you ways not to recreate it, eat better, exercise, deal with stress. I use neuroemotional work, and here's why. I use functional nutrition, and here's why. I use, neurofeedback, and here's why. Like whatever it is that you do. And once you're extremely clear about what you do, why you do what you do, what don't you do, why don't you do it, now we have to learn how to communicate it. And that's where we need to understand the neuroscience of communications. So again, we'll be diving into extreme detail in that, but I just want to touch on a couple of points. The neuroscience of communications, in essence, is how do you get people to say yes, who want to say yes? Am I trying to Aikido wrist lock people to say yes who don't want to say yes? No, that's not what I'm trying to do. But you can cause people to say no when they wanted to say yes. One of my favorite books on this is Influence the Psychology of Persuasion by Robert Cialdini. He does all kinds of wonderful studies, and my entire communications program is deeply steeped in his understanding of these things. But one of the studies they did was they had a waiter walk up to a patron at a restaurant and say, what would you like? And if the person said, I'd like a ham on rye, hold the mayo, and they said, oh, cool, you'd like a ham on rye with no mayo, they lost 23% of their tip because they said with no mayo instead of hold the mayo. Right? Little things like that, because you're not using their words, their lingo, their language. You can literally cause people to say no who wanted to say yes. So I'm not trying to get people to say yes who wanted to say no, but I am trying to get people who want to say yes who wanted to say yes. So just think about it. Have you ever had a patient that seems to be with you every step of the way and needs to go home and think about it? Have you ever been talking with a patient and all of a sudden their eyes glazed over and crossed and started drooling and the spit went down their belly button and came back, hit him in the face? Yeah, you've caused it. You may not know why you caused it, but trust me, you caused that, at least most of the time. Could it be that they were on drugs? Sure. But recognize that we can cause these things, and the better we understand it, the better chance we have of not causing it. So we're going to be diving into the neuroscience of communications, which is a simple concept. You got your reptilian brain, which is all about survival, food, fighting, and fornication, and you are filtering information all day long. And 94 to 98% of the information does not make it past the reptilian brain of the neocortex. So what does the neocortex do? Well, the neocortex is thinking, reasoning, and problem solving, executive decisions. So would you like the information you need to communicate to your patient about what you do and how you might be able to help them? Would you like that to make it past the reptilian brain of the neocortex for thinking, reasoning, and problem solving? Of course, because if it doesn't make it here, they drool and then they have to go home and think about it. So of course you want it to go past there. Well, there's very specific things we need to do to make that happen. Things we can do that will literally cause it not to happen, and things we can do to cause it to happen. Now, if that makes sense, it'll drop into the limbic system, which is where emotions are, belief systems are, and also all buying decisions. I am positive you have Rosenites in your practice, Smithites, Gagliardi-lites. Like, you've got all these people who love you and they get it, right? The problem is we don't have as many as we might like. And again, you can have more of those if they really get it, if you can drop into their limbic system. So we're going to be showing exactly what causes it not to work, which, trust me, the odds are, if you haven't studied this stuff, you're doing some of it. And then we're going to show exactly what does work. And the odds are you've had consultations, exams, and reported findings that worked really well. The question is it by design? Can we do it every time? And the answer is yes, you can. Now, they may not want what you offer, and that's okay. But at least I want them to be clear about what it is I offer and how I might be able to help them. So I hope that you find value in that. I'm going to scroll on down and see if I'm there. Oh my goodness. Let me hit the little refresh button right there, and hopefully it's recording and I'm there. I should have checked that before I did this long wrap. Okay, cool, I'm there. And I'll see if there's any questions. No, okay. So if you do have any questions right there, if you want to say aloha to me, please go ahead and do so. We have about a 6 or 8 second delay. If not, I'm just going to jump. Okay, good. So any questions, go ahead and make comments. If you would like access to the club, put club below and I'll get you a free month in there. You can join if you can make it to the live call. If not, I post them all. You can download this and you can download this, and you can, I have just an amazing amount of information there that you can jump right into. So hope you find that of value. If you did, please let others know about it. I wanted to keep it under 15 minutes. We're at 14 minutes right now. As always, much love and aloha. Bye, gang.